My name is Jennifer France, and I'm an advisor here at Digital Benefit Advisors in Richmond, Virginia. We are the broker for Orange County and Orange County Public Schools, and I'll be walking you through the presentation today. If you do have any questions after the presentation is over, please feel free to reach out to your Human Resources Department, and they'd be happy to assist you with any questions. On the agenda for today is we're going to go through a quick overview of the renewal for the 2015-2016 year. We're going to cover the medical plan options and the new rates for you as employees of Orange County Public Schools, go through resources that Anthem has available to you, the dental benefits, ancillary benefits, and then how to enroll or make any changes for this particular school year. Let's cover a brief overview of the medical, dental, vision, worksite, and legal plans. Just a quick overview on the medical products. We are going to be renewing with Anthem. Overall, there was an increase of about 7.7 to 10.5% depending on the plan that's selected. Orange County Public Schools did work very hard to try and come up with the best possible options for you as employees, along with providing the best possible pricing to you as well. They did not want to move to a single option plan. They wanted to be sure that you had different elections that you could make so that you could work out what was best for you and your family. Because of the plan changes that we did have to make, the majority of the employees should see no increase or possibly even a reduction, a slight reduction in the payroll deductions going forward. The plan changes that we did have to make were eliminating the Health Keepers 2020 plan with no deductible. There will be something similar, but it will have a deductible going forward. And the Key Care 15 plan is going to be changing. We're eliminating that plan and changing it to the Key Care 25, which also will have a deductible attached to it as well. The good news is on the dental, vision, worksite, and legal plans that we are renewing with the current vendors. There aren't any changes to the benefits and no changes to the rates on any of those products. We will cover them briefly as we go along. So let's talk a little bit about the medical benefits first. Anthem did have some mandated changes that will take effect. This will be effective October 1st of 2015, along with your other benefit options. They did require, as part of the Affordable Care Act, there were some mandatory requirements that needed to be made for the 2015 year. One of those is that prescription drug costs will now count towards medical out-of-pocket maximums. Most of you that were on the plans before never probably realized that you had a separate out-of-pocket maximum for medical benefits and then a separate out-of-pocket for prescription drugs. Those now are going to be combined so that you will have one out-of-pocket maximum to meet going forward. Prescription drugs now also are going to be moving from 3 tiers to 4 tiers. We'll talk about that a little bit as we go through the Anthem options that are available to you for 2015. Mail order copays are now going to be 2.5 times the retail copay on all tiers for a 90-day supply. And so you'll see where that'll still be a benefit to you if you do decide to use the mail order services going forward. And again, we'll talk about that in a few minutes. Applied behavioral health, which is basically coverage for autism spectrum disorder. The benefit originally did have a $35,000 limit. According to the Affordable Care Guidelines, mandatory guidelines, that limit is being removed now, and there is no longer that limit going forward as of October 1st. Preventive care, let's talk about this a little bit because no matter which plan you choose on the medical benefits, preventive care services are covered at 100%, excuse me, in-network. As long as you are going to an in-network provider, you should not have to pay any copay, you should not have to pay any deductible for certain preventive care services. Now these services meet the requirements of federal and state laws. And typically they include immunizations, physician visits for routine exams, screenings such as your physical, well baby visits, immunizations for newborns and children, ladies, your well woman visit, your GYN exam, mammograms, those should all be covered as preventive care services with no copay and no deductible being applied. Now, if you have any type of diagnosis that is tied to those services, for example, if you've had a mammogram in the past and they've found some lumps that they had to go in and take a look at, and a diagnosis is tied to that when you get your next exam, then it's no longer considered to be preventive care. Great example of this when people go and have a colonoscopy. If the colonoscopy is your first routine colonoscopy after the age of 50 and there's nothing that shows up, obviously that's going to be covered at 100%, no cost to you, because it's considered preventive care services. However, during that screening procedure, if something comes up, if they have some areas where they need to do a biopsy, if there are polyps that are found that they need to remove, at that point there's a diagnosis tied to that, there's some intervention that's tied to that, and it's no longer considered preventive care, and you would be charged for that service. Okay, let's talk about the 3 medical plan designs that you have access to. Again, all of these would start effective October 1st, 2015. You have your choice between 3 options with Anthem: the HealthKeepers 20-2500, the KeyCare 25, and the Luminos 3000 high deductible plan. So let's talk about these a little bit. Let's start with the HealthKeepers 20-2500 plan, which is the closest there to the left-hand side of your screen. All 3 of these products have no referrals required. So the 20-2500, you do not have to have a referral from your primary care physician to see a specialist. You can do that throughout the year with no referral. All the benefits are listed on a calendar year basis. So when I talk, not all of the benefits, but all of the benefits on the 20-2500, I should say, are listed on a calendar year basis. So when you see the deductible that is there, the maximum out of pocket that's there, those are based on a calendar year basis. Your annual deductible is going to be a $500 deductible for an individual or $1,000 for a family. However, those deductibles do not apply to physician office visits. So if you go a little bit further down, you'll see in that column that preventive care on all plans is covered at 100%, as we just talked about a minute ago. And physician's office visits under this 20-2500 plan would be covered at a $20 copay for your primary care physician or $40 copay if you go to see a specialist. So if you have a strained muscle and you need to go see your primary care, you're going to pay a $20 office visit for that. If you need to go to an orthopedic doctor, you'd pay a $40 office visit for that. That's not subject to the deductible, so you don't have to pay the deductible first on those office visits. The same situation with urgent care. You have a $40 copay if you go to an urgent care center. Now, as you can see there below, if you do go into the emergency room or have inpatient or outpatient services, then your deductible is going to apply. So if you have a serious illness where you need to go into the hospital, you do have a $500 deductible that you would need to pay first, and then the benefits covered at 80% after that. You pay 20% after that until the total that you've paid out in your out-of-pocket expenses reaches $4,500 on an individual, or $9,000 if you have a family plan. Once that out-of-pocket is met, then everything's covered at 100% for the rest of that year. So if you do go into the doctor's office and he has lab services that he needs to have done on you, if those lab services are done in the office, meaning they're doing the draw and the lab work in the office, and he's charging you as part of that office visit service, then it's going to fall under your $20 or $40 copay. If, however, you have to go outside of that office for to a separate lab, or you need to go and have an x-ray done at the hospital, those type of services, that would be considered outpatient, and you'd have to pay the deductible first. All right, let's move on to the KeyCare 25 plan. Very similar in many ways. You do have a $500 deductible individual, $1,000 family. Again, preventive care is covered at 100%. Your physician office visits are slightly higher copays. If you go to the primary care, it's going to be a $25 copay. A specialist would be $50. And then urgent care would be $50 as well. You do have the option on the KeyCare, though, of going in or out of network. On the Healthkeepers plan, the 2500, you do need to stay in the Anthem network, which really should not be a problem. There are plenty of Anthem providers in your area for you to choose from. So let's get back to the KeyCare 25 plan. Again, you have a $500 deductible on an individual. That would again apply to the emergency room, inpatient services, and outpatient services. So the main differences between the 2500 and the PPO 25 are basically the copays are slightly different. The percentages, the coinsurance percentage of 20% is the same, but you do have the ability, as I mentioned on the KeyCare 25 plan, of going in and out of network for services. Then the Luminos 3000 deductible plan on the right-hand side of your screen is another option for you. It's going to be the least expensive option in terms of benefits for you. This 3000 plan is truly a high deductible health plan, which means that you have to pay the deductible first before services are covered. So as you can see there, other than preventive care, I should say preventive care as an exception is covered at 100%. As you can see there, everything else is subject to the deductible. So if you do take this plan, it's a $3,000 individual, $6,000 family deductible. You do have to pay that deductible first, for example, before your physician office visits are covered. So if you go into the doctor's office on the high deductible 3000 plan and your office visit, for example, is a $100 fee, the doctor will send that claim to Anthem. Anthem will process it. They will apply their standard discounted rate to that. Let's say, for example, that Anthem's discounted rate is $80 for that service. Then Anthem will send you and the doctor a statement saying that that visit should be $80. And then what you'll do is you will pay the $80 to that physician. You'll continue to pay that until your deductible has been met. Same situation for the emergency room, inpatient or outpatient services. You do have to pay the deductible in total of $3,000 on a single, $6,000 on a family before those benefits kick in. But the good news is once that deductible has been met, then you don't have to pay any other coinsurance after that. So this particular plan is a good option for someone who's young and healthy, not going to the doctor very often, if at all, doesn't have any prescriptions that they're taking on a regular basis, because this benefit is going to be the least expensive, and in addition, it's also going to be the best benefit for you because you're really not using the services. I kind of relate it to gym membership. Why pay for a gym membership if you're never going to go to the gym? So in this particular situation, why pay for a higher deductible plan or a higher copay plan when you're never going to use the benefits? Let's move on a little bit here to the prescription drug benefit, because I do want to talk about that a little bit. The prescription drug benefit is the same for the 2500 and the point of service, the PPO 25 plan. They are the exact same. It's a 10/30/50/50 drug card. So once you go into the pharmacy, you're going to pay one of those 4 tiers. It's a little bit different this year. As we mentioned, there is a 4th tier. The $10 drug card is typically generic, although it's not always a generic-based medication. But those are most often your lower cost, typically generic medications. Tier 2, brand name, maybe some generic. Tier 3 typically is a higher cost brand name medication. And then Tier 4 is primarily going to be what they consider high-cost injectables. And when I say injectables, I don't necessarily mean insulin. Insulin would not typically be a Tier 4. The Tier 4 drugs would more often be things like the new hepatitis drugs that are over $1,000 a month. Those type of medications are going to be on a Tier 4. There are very few medications on that list, so most often you will not need to be concerned about those. But if you do have questions about what's on that Tier 4 drug list, you can contact Anthem, or you can go on to anthem.com, and they do have a listing of the drug formulary there as well. Now, the high deductible health plan, the Luminos 3000 deductible plan, on that particular plan, you do have to meet the deductible, as we mentioned earlier, first before prescriptions are covered as well. So you do need to keep that in mind. If you have a higher cost medication, let's say maybe it's a $200 total cost per month, you do need to keep that in mind with this high deductible plan if you decide to take it, because you do have to pay that medication at the time that you pick it up from the pharmacy. And you do have to pay that in full until you've met that $3,000 deductible on a single. Once that deductible has been met, then you would move to a copay situation, as you see here, with the 10, 30, 50, and 20%. That's after the deductible. All three of the benefit options have mail order prescription drug coverage as well. The point of service 20-2500 and the PPO 25 have a copay for a 90-day supply of $25, $75, and $125, depending on which tier that medication falls into. And then again, on the 3000 deductible plan, you do have to pay the deductible first, and then you could use the mail order at the copay situation, at the copay level. Okay, let's talk a little bit about the high deductible plan that we just had covered, the 3000 high deductible plan. If you do take that particular benefit, then what you have the option to do is you can set up a health savings account. Now again, this is only available for those employees that would take the high deductible health plan. This is a health savings account that your Human Resources Department would give you information to help you start up. It's a lot like 401k or an IRA in the sense that you're taking money out of your paycheck pre-tax, putting it into a specific savings account that you can use going forward for qualified medical expenses. And when I talk about medical expenses being qualified, they're medical, dental, and vision expenses. You can reduce your taxable income because you're taking money out of your paycheck pre-tax and putting it into that account. The interest gained over the time that money is in the account is tax-free, and you can take it out of the account to pay for qualified medical expenses without paying any taxes on it. The best news is that Orange County and schools, if you set up a HSA account, is going to contribute $1,500 to that HSA over the course of the year. So again, as I mentioned on the $3,000 high deductible plan, if you're a young, healthy person, you're typically not using the medical services a whole lot, you can take the high deductible plan, set up a health savings account. Orange County will contribute $1,500, so half of your single deductible into that account over the course of the year. If you're not using the medical benefits, basically this money is sitting in an account just waiting for you to use it later, and you're continuing to save it, as well as putting in some of your own money to save for future years where you may need the medical benefits and may need to have that money available. This money, though, is vested immediately. It's completely yours. Once Orange County Schools puts that money into the account, they have no control over it after that point. The money is yours. It's only in your name. It's not available to Orange County at all. It's portable, So if you retire or leave the school system, it's your account and you can take it with you. Even the money that Orange County and schools puts into that account is yours going forward, and you could take it with you if you do leave the county. There is no use it or lose it, and a lot of people were concerned about this when these first came out. They were familiar with flexible spending accounts where you had to really budget, and if you didn't use all that money that was in there, you lost it. That is not the case with the HSA. With a health savings account, it truly is your money invested the way you want, and it's yours. If you don't use it, it continues to sit in there and continues to grow if you're continuing to take elections out, and it just sits there until you use it. You can invest those deductions in Vanguard investments. The administrator for the health savings account that we would have you set up is called Health Savings Administrators. And again, they have Vanguard options that you could actually invest in if you wanted to, but you don't have to do investments. You can just let that money sit in there and continue to grow. You can elect a debit card. So if you take the high deductible health plan and 6 months from now you have, let's say, $500 in your health savings account that you've contributed and the schools has contributed, and you need to go to the pharmacy and pick up a $200 prescription, you can go do that, use your debit card, it comes right out of that account. The maximum annual contributions for 2016, you can contribute $3,350 on a single person or $6,750 if you do have a family account set up. And again, if you are over age 59 or 55, I'm sorry, you can add an additional $1,000 every year to that. The federal government says if you're over the age of 55, they want you to try and start saving more money for your medical expenses going forward. As everybody knows, typically as we get older, we have more medical expenses. So the federal government is allowing you to take money out pre-tax, adding additional $1,000 if you're over the age of 55 to build up the cash in that health savings account for you. So who can participate in the HSA? Again, you have to be enrolled in the qualified high deductible plan. You can't take the Health Keepers or the PPO 25 plan and set up a health savings account. You can't be enrolled in Medicare and still contribute to the account. You can be enrolled in Medicare and take money out of the account. So if you are, let's say, for example, 60 years old, and you decide that you want to take the high deductible health plan and set up a health savings account, you can put money into that account every year until you hit age 65 and go in Medicare. Once that happens, again, you can't contribute any more money to the account, but you can take the money out of that account as you need. You can't be enrolled in TRICARE, receive VA benefits. You can't be covered by another health insurance plan. In other words, you as a, let's say you're a young person who's still on their parents' medical benefits, you cannot set up your own health savings account, take the high deductible plan, and put money into it if you are covered on your parents' plan right now. Same situation if you're covered by a spouse's plan right now. You cannot contribute to a health savings account. And you can't be enrolled in a flexible spending account and also a health savings account. The federal government will not allow you to double dip. So if you have a flexible spending account, or flexible savings account, I should say, then you have to have all the money spent out of that flexible spending account before you can start contributing to an HSA. Again, if you have any questions on this, please feel free to reach out to your Human Resource Department, and they would be happy to get the responses to your questions for you. Saving in an HSA, again, you can put away this money tax-free. So it goes in tax-free, it comes out tax-free as long as you're using it for qualified medical expenses. You don't have to get reimbursed right away. You can save receipts for years before you reimburse yourself. You just need to make sure that you do keep receipts. They typically will not ask you for them, but if you're ever audited by the IRS, you do need to show that whatever money you've put in and spent out of that account has been used for qualified medical expenses. Let's say, for example, you have $1,000 in that account and you want to use it to help pay for a big screen TV. You can take money out of that account for that, but you're going to have to pay taxes on it and a 20% penalty if you do it before age 65. So this would not be the best investment tool for you if you're trying to save for your child's college education. You need to set up an IRA or something else for that. But if you truly are putting money into this to try and save for future medical expenses, this is the best way to do it. There are some fees associated with the HSA. There is an annual $45 fee to keep the health savings account in play and provide you access. Again, though, keep in mind that Orange County Public Schools is putting in $1,500 into that account for you going forward. All right, let's shift gears a little bit and talk about some features that Anthem has available to you this year. All three plans are through the Anthem product line, and as such, you have access to Anthem.com. You can set up your own username and password on Anthem.com. That way you can check the status of your claims. You can request a new member ID card, look up some prescription costs. It also has a smartphone or tablet product available to you, so that if you have a smartphone, there's an app for that now that you can download onto your smartphone or tablet, and you can access certain information via your smartphone as well. So if you're in the doctor's office and you forgot your ID card at home and you have a smartphone, with your username and password, you can look that up on the app on your phone and show them a copy of your ID card, for example. Live Health Online is something that we talked about briefly last year in the meetings if you were a member of the Orange County Public School program last year. But it is an app that's available online that's very handy to use. We've had quite a few people say that they really like the ease of the application itself, but it's basically a way for you via a tablet, smartphone, computer to see a doctor 24 hours a day, 7 days a week. It's available anywhere that you have an internet connection, so you could do it at home, you could do it at the office. It does give you access to U.S. board-certified doctors. It's basically the same price or less than a regular doctor's office visit, and they can prescribe certain medications over the phone. If you are on one of the KeyCare 25 or the HealthKeepers 20-2500 plan, you basically are going to pay your primary care copay for that visit. If you're on the high deductible health plan, where we talked about you're going to have to pay that whole deductible first, you may want to consider using Live Health Online for really minor things like the flu or sinus infections or something like that, because they're going to charge you a $49 fee to see the physician via this web tool, which can be a lot less expensive than going to the doctor's office. Again, it's available 24 hours a day, 7 days a week. So if you are at home over the weekend and you've gotten a sinus infection, it's just that time of year with allergies, and you have a sinus infection, you can use your tablet, smartphone, computer, talk to a physician over the computer. He can diagnose you. He can call a prescription into your local pharmacy. You can go pick up that Z-Pak and get it and be on your way within 15-20 minutes. It's a very easy, simple, convenient thing to use. Okay, let's switch gears and talk a little bit about the dental benefits that are available to you this year. Again, as we mentioned at the beginning of the session, these have not changed. So the benefits and the costs have not changed to you for the 2015-2016 year. We're still providing coverage for dental through Delta Dental. There are 2 dental plans to choose from, the low plan and the high plan. Those are both shown there on your screen. The low plan does have a $1,000 annual maximum. That's the most that Delta would pay out per year per person. It does have an annual deductible of $50 per person or $150 max per family. The deductible does not apply, though, to preventive services. So when you go in and get your routine exams, your cleanings, your bite wing x-rays, those are all covered at 100%, and you should not have to pay any deductible for those. On the low plan, basic services such as fillings, those type of things are covered at 80% after the deductible. So if you needed to go in, you had your preventive exam, and then they found out that you needed a filling, and you're going to have the filling done, you're going to have to pay the $50 deductible, and then it's covered at 80% by Delta, you pay 20%. Okay, and again, there's an annual maximum of $1,000 per person on that. Major services and orthodontics are not covered on the low plan. However, they are covered on the high plan, and the high plan benefit is a little bit better benefit. It's got an annual maximum of $1,200 a year per person. You only have a deductible of $25 per person, up to $75 maximum per family. Again, no cost for preventive services. Same 80% coverage for basic services, but you also, under the high plan, have coverage for major services like crowns, dentures, implants, and orthodontics. You do have a 50% benefit as well. There's a lifetime maximum of $1,000 on orthodontics. So if you do have someone who needs braces in the family, could be a $5,000 cost. You do have a $1,000 lifetime maximum that's paid out by Delta for those services. Delta Dental also has a relatively new program called Healthy Smile, Healthy You. On the screen, you see that there are some medical conditions that if you have one of those conditions and you're in the middle of treatment for one of those conditions, then you can get an additional cleaning or periodontal maintenance procedure during that time that you're being treated for those conditions. And that is available at no cost to you. You and your physician just need to work out the logistics of that. Your physician basically would contact Delta, tell them that you're in the middle of treatment, and then you would get an additional cleaning per year. All right, let's move on to the other benefits that you have available to you. Again, this year, Orange County Public Schools is providing benefits through the IMED Voluntary Vision Plan. This is something that you would have to elect as part of your payroll deductions. If you're interested in the vision plan, it does provide a benefit of giving you a vision exam every year for a $10 copay. You do get lenses for your glasses every 12 months for a $10 copay. You do have some additional costs if you wanted a progressive lens, for example. That would be an extra cost to you if you're wearing a bifocal or trifocal, that sort of thing. So if you do need that, again, that would be an extra cost to you, but that is available. Frames, you would get one set of frames for a maximum of $120 allowance toward those frames for the year. It's actually a 24-month. So every 2 years, excuse me, every 2 years you would be able to get $120 allowance towards frames, and then you get a discount on any balance over the cost of the $120. You can get contact lenses in lieu of the frames. So if you decide that you don't want to wear glasses anymore, you want to have contact lenses going forward, you would get a $135 allowance towards those contact lenses for the year. Last year, Orange County Public Schools put into place several different options with a company called Assurant. One of those options, which is available to you for this year again, is a voluntary accident plan. This is basically designed to help you meet your expenses, out-of-pocket expenses, once you have an accident. This basically pays money to you, cash to you, not to the physicians. So for example, if you fall and break your ankle off the job, let's say that you did need to go into the emergency room, it would pay you $150 for that emergency room benefit. If you do have to stay in the hospital, it would provide benefits at $250 per day, pays that money to you, not to exceed 365 days. And then, for example, if you fractured your ankle and it was a open reduction, meaning that the wound was open, you could get all the way up to $5,000. It just depends on the schedule and what's broken. If you would like a schedule of those, please reach out to the Human Resource Department and they can give you more information on the accident plan. It also would cover things like burns, concussions, those type of things. So I use my son as an example when he hit his head playing basketball and had to go in and have an MRI done and had to wear a neck brace for a while. We did get a payment from this. It was an accident. So we did get paid for the emergency room. We did get paid for the concussion that he had. So there are ways that, you know, it pays money direct to you. In addition, if you have this benefit, for those of you that already have it and haven't done this yet, this is a good reminder. If you take this benefit, you do have an annual wellness benefit. So when you go and get your routine physicals, ladies, when you go and get your pap tests and your mammograms, turn that into Assurant. They will pay you $50 for you and $50 for your spouse if your spouse is on the accident plan. They will give you that money just for going to see the doctor for your routine physical. Assurant also provides a critical illness plan that you can select. This would be for someone who may have a history in their family of things like cancer, heart attacks, those type of things, but they haven't actually been diagnosed with anything yet. You might want to consider taking this type of plan where it gives you a lump sum payment paid directly to you if you have any of the conditions that are on the screen listed that come up during the course of that year. So for example, if you take the critical illness plan and you later are diagnosed with end-stage renal disease or end-stage kidney disease is what they call it, then you could get a lump sum payment paid out to you directly for that particular condition. It also does provide a wellness screening similar to the accident plan. So if you get your annual physicals, you can be paid a $50 lump sum payment to you for getting that physical. Assurant short-term disability. The short-term and long-term disability are provided by Assurant as well. That is something that you can elect as part of the benefits. The short-term disability basically pays you when you are unable to work due to an illness or an injury. So once you've been sick or if you're hurt and can't work for 14 days, the benefits start on that 15th calendar day. And that benefit will pay you 60% of your covered earnings. And it will cover you up to 11 weeks. Again, there's a lot more information that is available if you're interested in talking with an Assurant representative to find out more information about these products or to sign up. Please contact your Human Resources Department and they will arrange for that for you. And the long-term disability, very similar to the short-term. Again, if you are unable to work for a long period of time, it will pay you out 60% of your monthly covered pay, up to a maximum of $7,500 a month. So this will take care of you if you are unable to work. Your number one asset is your ability to make income, yet very few people actually have insurance on their ability to make money. The short-term and the long-term disability is actually insurance to assure that you are taken care of if for some reason you can't work for a long period of time. Moving on to the Optima EAP, or the Employee Assistance Program, this is something that is completely free to you. It's no cost at all to you. It is available 24 hours a day, 7 days a week. You can reach out to a counselor over the phone. It's completely confidential. Orange County Public Schools has no record of this. They are not notified that you have ever called or talked with a counselor on the phone. You can talk with them about any number of issues. It's not just for things like mental health, depression, anxiety type issues that people call for. Very often people call because they've got financial concerns. They're struggling financially, and they need to talk to someone about what they can do. You can reach out to the Optima EAP program over the phone. They may be able to give you some advice on financial counselors to talk to in the area that are free of charge. They may be able to give you some additional information in terms of financial planning. Workplace conflicts, if you're not getting along with the principal in your location, or if you and a coworker are not getting along, you can call this number 24 hours a day, 7 days a week, and they will be more than happy to talk with you and kind of walk through things with you. Legal issues, if you need some legal assistance, they can't provide actual legal assistance to you, but they can recommend some legal programs in the area for you. Perfect situation, or perfect example of this, I did have someone in some meetings a few months ago that needed some elder care. They were taking care of an elderly parent in their home. That parent had dementia and was not able to live in their home by themselves any longer. The employee had their mother living with them, but the employee needed to go back to work. She had to start paying the bills. So she needed someone to take care of her mother during the day while she was at work. She called the Optima EAP program, talked with them about it. They were able to give her some recommendations for adult daycare centers in her area that she could reach out to. That's just one of the many services that the EAP program provides. Again, it's all free of charge, no cost to you, and completely confidential. Legal Resources is another plan that you can purchase. It provides 100% coverage for you, your spouse, and dependents for any number of legal services. Reviewing of a financial contract, will preparation. They can give you legal advice and consultation. They can represent you in a traffic court case. All of those things are available to you through Legal Resources. If you are interested in signing up for that plan, you do want to reach out to your Human Resource Department, and they will have forms available for you to do that. A flexible spending account is something that you could elect if you are not taking the high deductible health plan and the HSA. So if you're taking the 20-2500 plan or the PPO 25 plan, the Key Care 25 plan, you could set up a flexible spending account. This also gives you the ability to take money out of your paycheck pre-tax, put it into an account to use for medical expenses. The way that I like to explain this, though, is it is a use it or lose it, so you do have to budget wisely. You can roll up to $500 that's left over each year. You can roll that from one year to another, but that's the most. So if you budget for $1,000 and you have $1,000 taken out of your paycheck and put into that account, and you don't end up using it, the most that you can roll over is $500. The other $500 goes away. It's no longer yours. So you do want to be a little budget-wise when it comes to the flexible spending account. Now, that's not to say that you shouldn't use it. If you are a person who you take a medication every day, every month, for the rest of your life, and you know that that medication is a $10 copay every month, then I suggest that you take that $10 times 12, have that money taken out of your paycheck pre-tax, and put into the flexible spending account to use. You're saving a little bit of money on your taxes. All right, so let's wrap everything up by telling you all of the information on what's needed. So you are going to need to complete a new enrollment form this year for your medical coverage. Everyone needs to complete a new form. There were some issues over the last couple years that people were not enrolled in the right plan, or they weren't sure that they were enrolled in the right plan, I guess I should say. So Orange County Public Schools wants to make sure we're starting with a clean slate. Everyone has to complete a new enrollment form this year to make sure you're enrolled in the right plan. The same with the dental. Even though you had dental and it's not changing and you don't want to make any changes, you still need to complete a new enrollment form this year to make sure that you're in the correct plan. If you're taking the high deductible health plan and you want to set up a health savings account, there is a form that you need to fill out so that you can set up that account. Current enrollees don't have to complete a new enrollment form. If you want to have the same amount taken out again this year, you don't need to fill out a new form. But if you want to change that election, then you do want to reach out to your Human Resource Department and they'll get you a new form to fill out for the 2015 year. Flexible spending. If you do want to set up a flexible spending account, you have to complete an election form. Assurant, which is the critical illness, the short-term, long-term disability, the accident plans. If you didn't enroll when you were initially eligible, you do need to go through the enrollment process and complete a form. You do want to talk with one of the Assurant representatives. They have been available in some of the schools within the last week or so, but you do want to contact HR if you were not able to meet with them, and they may be able to come out and meet with you another day. Legal resources, you need to complete an election form if you want to enroll for the first time. If you want to keep it, you're already on it, and you want to keep it as it is, there's nothing that you need to do. Again, all of the forms are due to Human Resources by Friday, September 4th. So you do want to make sure that you look through that packet of information that you should have received either at your schools or at one of the meetings. That packet has all of the forms and information that you need to continue on with your elections for this 2015-2016 open enrollment period. Once you have elected your benefits, if you do have questions afterwards, if you have a claim that comes up from Anthem that you're just not sure why you're getting this bill, not sure what the forms mean, please reach out to a member of our team here at Digital Benefit Advisors. We do have a dedicated customer service team that can help answer questions for you and can research things with Anthem and Delta and IMED just to make sure that you're getting the right information. That's available as well. And that information that's on the screen is also available in the enrollment packets that you received recently at the schools or at one of the meetings. That ends the Orange County Public Schools Employee Open Enrollment Benefit session. Again, if you do have any questions, please reach out to Yvonne or Heidi in the HR department, and I hope that you have a great school year. Thank you very much.